So good afternoon, and thanks for joining us for the Community Care Centers of Excellence informational webinar. My name is Emily Crotty, and I am the Patient Access Project Manager. And to my left here is our lead, Jeff Lomax, who is the Associate Director of the Patient Access here at CIRM. During this webinar, we will be sharing valuable information about the Community Care Centers of Excellence, CCCE program, which aims to establish geographically diverse and culturally responsive centers of excellence to support access to FDA authorized clinical trials involving cell, gene, and regenerative medicine treatments. Our goal today is to provide you with an overview of the CCCE program, its objectives, application process, and the support that is available for our applicants. So during this session, we encourage you to actively participate in today's webinar following Jeff's slide presentation. To ensure a smooth and organized Q&A session, please follow these guidelines when submitting your questions via the Q&A chat. First, use the Q&A feature within the webinar platform to submit your questions, and as we proceed, we will categorize the questions by topic to keep the discussion focused and efficient. We will also prioritize the most relevant and frequently asked questions to address the most important concerns. One thing that I failed to mention in this slide is that we will also have the raised hand feature on the Zoom, so please utilize that to ask in-person questions, to which I will unmute you once I see your hand. If we don't get to your question by the end of this session, please feel free to send your inquiries to ccce@cirm.ca.gov, and we'll make sure to respond as soon as possible. So you can find the slides in a comprehensive FAQ on our website. Simply go to CIRM's Funding Opportunities page to download these materials. Following this webinar, a recording of this will also be available on our CIRM TV YouTube channel, and you can access that directly at CIRM TV on YouTube. These resources will be very helpful to review the information shared today and to get answers to any additional questions you might have. I will now pass it off to my colleague Jeff to read our mission statement and provide an overview of the CCCE request for application.
Right. Thanks so much, Emily. Welcome, everyone. So our mission is accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. The program I'm going to describe for you this afternoon is really one of the main programs that's going to support delivery of clinical trials and regenerative medicine treatments. So very excited to present this to you today. If you have not already, this is the INFRA 8, or what we call Infrastructure 8. That's Community Care Centers of Excellence. There's a landing page for this program. Critical dates to be aware of is that by the end of this month, we will have the actual application. What you view now is the request for application, what we're asking for. The online portion that will allow you to respond to that request for application will be available at the end of this month. And then the final applications are due by 2 p.m. on August 15th. In addition, I wanted to direct you to some additional background materials. You can check our website under meeting archives, but on June 22nd of last year, there was a public workshop. There's a number of materials in that link, specifically items from a needs assessment that we performed that may be informative in terms of your response. And then on January 25th of this year, our board engaged in a discussion of this request for application, and some of those comments may be of interest and value when you're formulating your response. So, as Emily noted, the objective of this program is to establish geographically diverse and culturally responsive centers of excellence to, one, support FDA-authorized clinical trials involving cell, gene, or approved regenerative medicine treatments. The second aim is to make these treatments broadly available to California patients. And as with much of our work of our infrastructure program, support the career development of a workforce in California to allow these treatments to be delivered on an ongoing basis. This slide gives you a framework or kind of a view of what this program looks like in the context of additional CIRM infrastructure programs, what we're calling our clinical infrastructure network. Currently, that network on the delivery end of things, this top left-hand quadrant up here, our Alpha Clinics network, consists of 9 awards. These are medical centers throughout the state that are supporting CIRM-funded clinical trials and trials outside of the CIRM funding stream. They're active. Many of these sites are available, or these sites are all available, and we can connect you if you would like to engage with those sites, as alluded to in the RFA, that there are resources available through those sites, and they're interested in sharing those resources with applicants. Coming across the screen here, you have the Community Care Centers of Excellence. And again, the aim is to bring a similar cell and gene therapy clinical research capacity to a broader set of communities across the state, with a particular emphasis on addressing social determinants that impact participation in clinical research. And that RFA is open. That's what we're discussing today. In the next slide, I'll touch very quickly on CIRM's clinical trials portfolio. We've funded over 100 clinical trials to date, and these trials are being supported by the Alpha Clinics network. And as part of this request for application, the Community Care Centers of Excellence would also be supporting those clinical trials. In addition, we've recently funded a patient support program. This program is intended to provide financial and logistical support to patients. And this program, as it rolls out, would be available to both the Alpha Clinics and community care centers to support patients. But that is a work in progress, and will, as that program develops, make information available so you can consider how you might better coordinate with that program as it develops. As I noted, we have a robust portfolio of clinical trials. I'm showing you a screenshot of our landing page, our clinical trials landing page, available on our website. Again, just to draw your attention to the resources you can look at in terms of understanding our clinical portfolio. This portfolio may impact sort of how you choose to develop your application. So please reference our website if you want to learn more about specific clinical trials. In addition, again, the Alpha Clinics network is has been very involved actually in the has been very involved in the needs assessment leading up to this. And they've developed a lot of resources that are available in some of the links I alluded to earlier. And we welcome the opportunity to facilitate contact between potential applicants and Alpha Clinic sites. If you'd like to contact us either through email, or email is the best contact, the one Emily displayed earlier. So we're again happy to facilitate that communication. So I'm going to turn now. That's by way of background. Again, our infrastructure programs, some of the resources you can tap into. The remaining slides are going to focus specifically on the RFA, what we're asking for, and I just want to highlight certain aspects of the RFA in particular. First and foremost, the applicant must have the ability to support clinical research operations. That support can come in sort of two varieties. At a minimum, the site would need to be able to support access to regenerative medicine clinical trials or approved products. And again, in the RFA, the level of what that support looks like is elaborated on in more detail. Or you may choose to come in as what we're describing as a support and delivery site. And a delivery site would have to perform all the functions of a support site, but in addition, develop the capacity to deliver an investigational regenerative medicine product during the award period. And in addition, not administer unauthorized stem cell treatments. And again, I would refer you to the request for application in terms of that, how we view unauthorized stem cell treatments. But that's a very important criteria, in that we only want to deliver authorized treatments to patients. The second component of the application is a career development, and we encourage applicants to adapt, apply, or otherwise utilize existing CIRM training resources. You can specifically, we're encouraging applicants or requesting applicants serve as a placement site for CIRM scholars and trainees. And we again have resources we can direct you to both training programs and link you up with a variety of the programs where those trainees are being trained, and consider ways which you can partner with those training programs to bring in people for career development. We also are very interested, and this again came about through our needs assessment, in looking for opportunities to integrate patient navigator and community health workers into the community care centers. Those are programs that exist within California, and how we can train up that workforce to inform patient populations about both clinical research and regenerative medicine opportunities. Outreach and engagement is another aspect of this program, and really looking for ways, and we're looking for you to propose ways you can extend and develop programs and create partnerships with community-based organizations to support clinical research, community development, and/or community engagement. And just a little bit of commentary there. What we've again learned through our needs assessment is that in many cases, where we see disparities or underrepresented communities in either clinical trials or research in general, is that there is issues of both trust, literacy, these various issues that fundamentally if we want to make progress, we really need to involve community partners that have a more direct relationship with some of these groups or communities. So there's funding here to bring in community-based organizations. I'm moving to the second bullet here. It became apparent that we need to dedicate resources to those types of partnerships, and within the application, you're required to propose at least one partnership with a community-based organization or organizations to support the aims of the program, which again are clinical research, career development, and/or outreach and engagement. And again, want to emphasize the emphasis on supporting activities that reduce disparities and support broad representation in clinical research, such as increasing referral rates for underrepresented populations. And sorry, to move the next one here. Sorry, I've got a little bit of a cluttered screen. Aha, there we go. Okay, so this is the award information and some of the details. This is a 5-year funding program, and the specific budgets will vary depending on whether you're proposing a clinical trial support site, which would be an award amount of up to $7.5 million per award, or a support and delivery site, which would allow a upper budget of $10.054 million. This program also allows for facilities funding. And this would, as applicants may allocate funds from the budget amounts I just described. So this is an additional funding. It's out of the budget limits that were just mentioned, from that award for facilities renovation and/or equipment. And some of the activities that those funds can be used for would be a renovation of facilities necessary for the delivery of investigational products to patients, purchasing or leasing equipment for the manufacturing or processing of products, and including but not limited to mobile manufacturing facilities, and renovation of facilities necessary to navigate, screen, or otherwise follow up with patients who are participating in clinical trials or receiving approved treatments. I wanted to emphasize, this gets back to both sort of either your community engagement efforts or partnerships or your relationships with community-based organizations. One of the things we heard within the needs assessment in particular from community-based groups that had historically partnered with academic centers, and particularly around medical interventions, was in some cases they felt the partnership was not sort of bidirectional and didn't really add value to the partner group. That really the sort of comment that stood out is, once the publication got written, the partner went away. So we really want to emphasize that we're looking for meaningful partnerships here that really build lasting and sustainable capacity within the community. And some of the factors that would contribute to that are trust, really building trust and trustworthiness with your partners and your community-based organizations. So, emphasizing, what would that relationship look like for trust building? Also respect for patients, your partners and their community. So considering ways in which you'll manage issues like data recognition for any research findings, results, what have you. So again, really respecting the partners and ultimately building sustainable benefit and capacity within these communities. So, how will your partners come out of this program with new capacities that will allow them to address barriers and conditions that contribute to disparities on an ongoing basis? And so this language is in the RFA very specifically because we want your responses to address these issues. So again, please consider them carefully as you're proposing your programs and partnerships. Some additional thoughts, again, things to think about as you're developing your proposals. How will your site coordinate with network partners? For example, the Alpha clinics or other community care centers to expand enrollment in clinical trials? How will your site, I think I've just said that. Is that a repeat? Sorry, I just got a busy screen here. Thank you. There we go. I'll just keep going, but the sooner we get to questions, the better, I think. And then again, how will your site add or expand the value of CIRM's existing clinical infrastructure network? That was the slide I showed of the various network components. I want to call out one of the key statements in the RFA, that applicants are encouraged to propose holistic and integrated approaches for satisfying the objectives of this program. For example, really consider how your different pieces will work together, sort of synergistically or be complementary, for specifically your clinical, career development, and community-based partnership initiatives. And how can you also work to synergistically with the clinical infrastructure network as a whole to help patients address barriers or conditions that contribute to disparities in health outcomes or health access. So again, the emphasis here is having these pieces really work together, work in tandem, not just kind of a potpourri of proposals. We also want to see a statement for how applicants will, how the community care centers will support underserved populations in clinical trials, how they will incorporate diverse perspectives into the implementation of the overall program, and fundamentally promote diversity, equity, and inclusion in research efforts broadly supported by this award. So both on the clinical research and some of the outreach and engagement activities, career development, et cetera. How will this result in a very inclusive and equitable system? Also want to call out some of the issues around knowledge sharing and evaluation. We use the term knowledge sharing, and that may include data sharing, but knowledge is a sort of a bigger framing here. That sharing knowledge is crucial for the success of infrastructure programs, and that all awards are required to have a data or knowledge sharing plan that includes collection, curation, and preservation of data. And in the context of this RFA, applicants must outline plans for capturing operational information related to core competencies, training programs, and outreach efforts. So in this case, again, we anticipate there would be both qualitative and quantitative data coming from this experience, and would encourage you to outline ways in which you could capture that data. And we also expect sites to report metrics on patient recruitment and accrual in clinical trials. So again, thinking in ways in which you can capture that data and develop knowledge at various levels to enhance access to regenerative medicine treatments. And I think one of the other areas, again, I want to call out, it's a little bit back to my sort of previous point about often community partners sometimes feeling at the end of these relationships, not feeling like they've received the benefit of the partnership. Really want to emphasize the need for how you would then disseminate knowledge and findings in a culturally appropriate way, which is a way of saying that all partners gain knowledge and information from this program and use it for future efforts. So with that, we're going to turn to the Q&A phase. I notice Emily's taking a lot of notes here, so it sounds like they are coming in quickly. Any hints on where we should start?
Yeah, I think there is one hand up, and Brian, you may go ahead and ask your question. I will be asking you to unmute whenever you're ready. No, they can hear us. He's muted himself. Brian, do you have a question? Okay, we will move on to Michelle in the meantime. And you can unmute yourselves and go ahead and speak. Something's going on.
We may have to go to the chat. Yeah, I'm going to go to the chat. So I'm going to read the first question. Does CIRM have a regenerative medicine delivery site, feasibility or self-evaluation checklist available? I want to identify any gaps in current capabilities to deliver regenerative medicine products. And we do not. I think in terms of a checklist, there is nothing, currently available. And we would, I think, again, that's a, again, an area where we could help you partner with or communicate, open up lines of communications with an existing clinical center that is that it has a history of delivering these products, and that would be my best advice in terms if you want to sort of itemize what would be required on the delivery side. So again, feel free to contact us and we can help connect you up with an existing site, which would be an Alpha Clinic site. Second question is there a formal definition of community-based organization that we need to use in identifying these partners? There is not. Trying to think if there's anything to add there. Let's say, so no formal definition, and if we have anything to add to that, we will add it to the frequently asked questions.
I think we have
Oh, there we go.
the chemical of fire. Do you know what that whatever?
All right, somebody's unmuted, but I'm not sure it's a question. Is there a question? Is there a question on a live question?
No,
Okay.
please disregard my hand up. Thank you.
Okay, thank you.
Hello? Can you
Can
hear me?
Folks are muted.
Michelle?
Oh, there you go.
Okay, hi.
Yes, we-
I'm sorry. I was wondering, I noticed that we can schedule a meeting to discuss I forget what the term is right now, but to discuss kind of our idea or program. I was wondering how flushed out should our program be before meeting with your team? Should we have a well-rounded idea of what we want to do, or can we workshop together? I wanted to get a little more information, and if there's a deadline in which to do that.
So we welcome inquiries during the throughout the application period. We would not be in a position to provide you evaluation, if you will, of specific ideas, but we would be happy to sort of talk through, we give you feedback to your proposals, but we don't actually want to get in, we would not be in a position to sort of provide sort of structured feedback on a written proposal. So I think feel free to approach us early and talk things through. And then at a certain point, we may not be in a position to provide, deep feedback, depending on, again, the nature of your question. So I think just thinking of it as an iterative process, we're happy to have early discussions where you'd be, sharing ideas with us and giving you feedback.
Great. I see here that it's called the pre-submission consultation. So just as I mentioned for my reference, is there a deadline for that?
We don't have a specific deadline. Obviously, I think you'd want to do that sooner rather than later, as the application itself would require a fair amount of time to complete. So I'd reach out early for your first discussion.
Thank you so much.
There's a question about, will data need to be shared, uploaded to CIRM via some sort of portal or reporting mechanism? Typically, we have, so the short answer would be yes. We typically would require the data to either be shared, depending on the nature of the data, but we have regular progress reporting in these types of awards. So, and that would all go through a standard reporting portal that is administered by CIRM. So there was a question about the budget allocation. And it's a good question. So 7 million versus 10 million, does this mean only 3 million for facilities or infrastructure? Or if one is applying to the $10 million category, can it be allocated outside the 3 million range? So the answer to can it be allocated outside the 3 million range is yes. It is not intended to imply that there is the difference is restricted to facilities or infrastructure. We just recognize that the entire package you'd have to bring forward in order to deliver regenerative medicine treatments requires additional resources, and you should, if you were to apply at that 10 million range, or to be a delivery site, you should craft your proposal in a way that shows us that you could successfully deliver clinical trials within that $10 million budget.
And we have a live question from Jacqueline. Jacqueline, you may go ahead. Please unmute yourself. Okay, we'll go back to the chat.
Yeah. Okay. Question for the training and education component. Does this include lab-based training or clinical training? For example, MD training for cell therapy and regenerative medicine. This particular education component for this award, we emphasize career development, and it's career development around the aims of, or the objectives of, the RFA. In this case, it's the delivery of clinical trials. So the training piece, to the extent it's, or the education piece, should focus on that aspect of it. So, you know, to the extent that a lab-based training is integral to the delivery of clinical trials, then that would be appropriate. But if it's lab in other aspects, for example, a more basic research, that would probably be outside the scope. So it's really, and we give a number of examples in the RFA, so I'll refer you to those examples, but it is career development around the delivery of clinical trials or approved product, as opposed to preclinical research or basic research training. There's a question about would a specific applicant organization be eligible? I'm going to defer that question, and that's something we can answer offline. Since it's a 5-year grant, will funds be allocated in equal amounts, or can funds be granted at different amounts at different times? I'm just going to look across the room. These awards will be granted on a milestone basis. And so what that typically involves is a disbursement of funds in accordance with a proposed budget, and then we'll work with the awardee to develop milestones that would allow the disbursement of those funds based on you achieving objective measures of success over the award period. So I will leave it at that, because I got a thumbs up from the budget team. And I might add, on that note, since we're talking about budget and funding, we will be scheduling a additional webinar, specifically to cover some of the budget aspects of this program once the application goes live by the end of the month. So stay tuned for that. There is a question in terms of the career development and training piece. Would it be acceptable for Community Care Centers of Excellence team to team up with resources that already exist with existing CIRM training resources, particularly the Alpha clinics? And the short answer is yes, in all caps. In fact, we very much want to encourage the utilization of already developed training programs to support career development. We have a robust selection of training opportunities and trainees, and this program is really an opportunity to build on that success as opposed to develop de novo programs. With that said, if within an application, if you believe there is a highly specialized need for training or career development, for example, some type of special skills necessary to address disparities in recruitment or participation in clinical trials, we you're welcome to propose that, but again, it should be clearly articulated that this is a special need that is essential to meet the objectives of the RFA. The partnerships can be with private entities, or must all partnerships be with nonprofits? Again, the partnerships, we do not specify public, private, nonprofit, or otherwise in terms of your partnerships, whether they're community-based or otherwise. So, yes, the answer can be with private entities. And we do have a definition of community-based organization. So I will read it, but also reference page 20 in the RFA. A community-based organization means a public or private nonprofit organization of demonstrated effectiveness that A, is representative of a community or significant segment of a community, B, provides education or related services to individuals in the community, and a community-based organization provider must be a public or private nonprofit organization with a 501c3 status or fiscally sponsored entity of a 501c3 nonprofit organization. So apologies there. We will include that in the we will include that in our online resources just since it came up as a question, and I apologize for my previous answer, which was erroneous. Is there an advantage for our application if there are placement of CIRM scholars and trainees? The serving as a placement site for CIRM's scholars and trainees is indicated as being responsive to this request for application. I don't want to necessarily characterize that as providing a particular advantage, but it's certainly something that's noted in the RFA, and serving as a placement site would be responsive. Do we have any other hands up?
Not at the moment.
Okay. I think I have covered all the questions that I'm equipped to answer at this time. So we'll take a moment and see if there are any additional.
Yeah.
We're good at the moment?
Mm-hmm. Okay.
And I just want to add if there were a couple of folks who we thought were going to ask live questions. If for some reason that was a technical problem at our end or your end, then please feel free to submit that question in writing. Again, the preferred address is ccce@cirm.ca.gov.
Or in the chat right now.
Or in the chat right now.
Yeah.
Yes. Here we get a couple more trickling in. So, will letters of support be required with the application? Letters of support are highly encouraged, particularly if you're proposing a partnership with a third-party organization. And stay tuned when the final application goes live. I don't recall at the moment if we specifically call out those letters of support. But the short answer would be it would be very advantageous to have letters of support from any organization that is integral to the implementation of your community care center of excellence. Let's see.
Yeah.
I'm just reading that one. Yeah, we covered that one. I'm sorry. Okay, we'll wait another couple of minutes if we get any other trickle-in questions. Yeah, we covered that one. We're all good.
Okay, we're all caught up.
All caught up. Okay, well, if there are no further questions,
Yeah, there are no hands raised, so.
okay. Okay, well, and thank you for the compliments in the chat. I'm glad you found this helpful. Again, you know how to reach us, and this concludes the webinar for the CIRM Community Care Centers of Excellence program. Thank you for your participation and questions.